For us is an opportunity to offload people. Now, a lot of times our clients come into us, they don't have the strength to do some of the exercises. Let's say we're doing pelvic lift on the reformer. The red cords allow us to give them a little bit of help so that they can build that strength without just trying to put it somewhere else. I remember working with people and they would be doing the pelvic lift and they felt it more in their back than they did in their hamstrings, or more in their calves than they did in their hamstrings. Well, now with the red cords and the way we've set up this Cadillac, we'll actually be able to offload them. So what I do is I have his legs in a position, it's about 18 inches off the table. Okay? What he's going to do is he's going to bridge on up, so just lever bridge up, and now he's going to pull his knees into his chest and then lengthen back out. Now what that does is you can notice we can work on building his core stability again, pull the knees in, and it keeps all the pressure in his hamstrings and lengthen out. Now when you do that, press a little bit more into the cords and pull in, and now we can really get that firing. We can also start to notice he wants to take his knees a little bit wide, but we don't want to turn them in. We want to keep them nice and parallel to each other, and then lengthen out. Now I need you to lift your hips back up that you lost and pull in and lengthen out. One last one, pull in. Now I'm going to go and have you extend your right leg out, lengthening and pull in. And left leg out, lengthening and pull in. The right leg out, lengthening and pull in. The left leg out, lengthening and pull in. And come on down. And lengthen the legs out. So that was all the hamstring work. Now we can adjust the tension with these bungees, and that's really the nice thing about the red cord, is that it allows us to work with almost any client. And it allows us to adapt the exercise to that individual, which is really nice. The other thing I like about the red cord, and I've been doing more and more with, is my older people that are into rotational sports come in and their back is really contracted, so it's very, very tight. So a lot of times what I do is I'm going to go ahead and pull this in. Yep, you're all right. There you go. Just relax. Good. What I'm going to do is I'm going to actually switch the ropes out, and for the bungee I'm actually going to put in a solid rope. What this is going to do is allow us to get a little traction. Now, if you do any kind of half hangs or full hangs on the Cadillac, sometimes if you have an individual like Justin here, he would be too tall for the apparatus. So we would be risking a lot of other things that could happen. This allows us to give him almost like an ability to offload his spine without putting extra tension into his neck or his head. So if you have somebody with glaucoma or anything like that, you can also work with this individual. So what I'm going to do is I'm going to actually lift him up. And these ropes are pretty easy to adjust. I'm going to pull this in a little bit. Go ahead and lengthen your legs to lift your hips up. That's all right. And then sit down. Now, what this does is this allows me to really offload his body. All right? And what we'll do is we'll end up just letting him hang here in a nice position for him to release his spine. In our workshop we'll talk about perturbation. This is one of the tools we use in red cord, and it really allows that back to stretch. We can also do some nice easy glide stretches which will help to loosen up that back. Now this is great for somebody like Justin, for the fact is he doesn't have the ability to, if I put him in the stirrups, his feet would still be hanging pretty low. So we can adjust this from the hip level and not from the foot level, which really makes it nice. This is a great attribute to my clients. Every one of my clients actually asks for this at the end of the session now. And they feel good because it releases their back and allows them to get a good stretch in there. Phenomenal for back patients. Any of your patients that are continuously being compressed in the lower spine, this is great for. Hopefully you liked the video blurbs I gave you, and I look forward to seeing you in California when I'm teaching anatomy for the Pilates routine.